I'm just going to be talking a little bit. It's really a primer on implementation science and highlighting the importance of this discipline in healthcare research and practice, and perhaps a bit on the distinction between implementation science and other types of research that we do. I always like to start with this quote, "A little knowledge that acts is worth infinitely more than much knowledge that is idle," by Khalil Gibran. Because as we know, there are many fantastic and efficacious innovations that often fail when they're implemented again, or when they're implemented in the real world, or that simply never get to the real world or never go beyond the initial place that they were tested. And we all can agree that that knowledge that is idle, that knowledge that doesn't get used, is really not reaching its potential for having the impact on population health. Implementation science provides us with methods and tools that not only better translate knowledge to practice, but also help us design strategies that help increase the adoption, implementation, and sustainment of these evidence-based innovations. So we know that the impact of an intervention or an innovation, and I'm going to be using these terms interchangeably to mean a number of different potential interventions, including things like policies and practices, programs, and including things like health education programs. This is an example here, the coordinated approach to child health, of a success story in which it was a multi-level intervention to increase child physical activity and nutrition. And this program was not just efficacious in one setting, but eventually was adopted and implemented in multiple schools around Texas and around the country. And this is an example of an intervention that was effective, but also had broad reach. And so impact is a function of not only effectiveness, but also reach in the population. The story of the research to practice gap is an old one. Lemon juice was shown to be effective in preventing scurvy in 1601, but it was not introduced into sailors' diets until 1795. So that's 195-year research to practice gap. So we're not doing quite that bad now. However, even now, there is a large gap, and there's a reason for that. There's many reasons that and many steps in the process of getting original research to routine practice. And this was a study that was done already 20 years ago, but it's one that's often cited because it was an analysis of what happens between original research to actual implementation. And as you can see, there are many places where original research goes to negative results, or it doesn't get published. There's issues with indexing, but the estimation from this study was that it takes 17 years to turn only 14% of original research to the benefit of patient care. And so implementation science studies methods and strategies that can facilitate the uptake of evidence-based interventions into regular use. And it seeks to close this gap. And it seeks to close this gap by generating knowledge so that we can do it not just once, but this knowledge about how to increase adoption, implementation, and sustainment can be broadly applied. So just some definitions. Dissemination itself refers to the distribution of an innovation or an intervention to a specific audience or to multiple audiences. And implementation refers to the integration of a new innovation within a specific setting or context. So then when we talk about implementation research, we're talking about the scientific study and the use of strategies to adopt and integrate evidence-based interventions into clinical and community settings to improve patient outcomes. And dissemination research is really the distribution of that evidence. It's more concerned with scale up and spread. And its intent is to understand how best to spread and sustain evidence. So these are overlapping terms. Sometimes people use them interchangeably, but really when we're talking about implementation research, we're studying what's happening within a particular context. And in dissemination research, it's more focused on scale up. This is a figure that you may have seen before, and it's designed to show the sort of the trajectory, what some people call translational research pipeline. So how do we go from pre-intervention to scale up and spread, and what research is associated with each stage? And so we think about pre-intervention research, that research that's done even before you're testing a new intervention or innovation. Then efficacy studies to test whether a program could work. Effectiveness studies of whether a program actually does work. And effectiveness studies as compared to efficacy studies are really considered testing more in the real world. And then making a program work. So understanding those factors that influence its adoption, implementation, sustainment in the real world, and the testing and development and evaluation of strategies to increase that adoption, implementation, and sustainment. When we compare implementation research to effectiveness research, we see that they have similar components, but the emphasis of these components differs. So in effectiveness research, we have an intervention and we're delivering that intervention. In order to evaluate an intervention, it must be delivered. And so there's a component of implementation that always is present in effectiveness research. Sometimes that intervention is delivered by the research team, and sometimes that intervention is delivered by practice partners. But nevertheless, in effectiveness research, the primary focus is on whether or not that intervention is effective. And then there's a background on its delivery, and sometimes we'll call this process evaluation. In implementation research, still those two components are there. There has to be an intervention or an innovation that's being delivered. But the focus here is on the system to support its adoption and delivery. And we're often concerned with things like fidelity and penetration in the population and reach. And so I like this figure because it shows that there are similar components, but the emphasis on those is different. You'll hear later in this workshop about what we call hybrid designs. Usually research is not purely, implementation research is not purely focused on this, although it can be, but many times it's looking at the outcomes related to implementation, what we call implementation outcomes, and also effectiveness outcomes. And so we call these hybrid designs, and you'll hear much more about this going forward. In this slide, we see differences between clinical or public health research and implementation research on various different dimensions of research studies. One of them is the aim. What is the aim of the type of research that we're doing? So a difference in the aim in terms of clinical or public health research is that the aim is usually to evaluate a clinical intervention, a health promotion intervention, or a policy. Does it work? In implementation research, you're evaluating the implementation strategy, those things we do to integrate it into practice. A typical intervention in clinical or public health research can be a drug, a procedure, therapy, or even a health education program. In implementation research, we're usually looking at an organizational practice, a change, a training. Typical outcomes in clinical or public health research includes symptoms, health outcomes, could be behavioral outcomes. And in implementation research, we're looking at outcomes such as adoption, adherence, fidelity, and level of implementation. And then the unit of analysis and the unit of randomization, oftentimes in clinical and public health research, can be the patient or the community member, whereas in implementation research, it's the clinic, it's the team, it's the facility or the school. So these are some differences that can help you understand how implementation research differs from other types of research. I mentioned hybrid designs, and I'm not going to talk too much about this because we are going to talk about this later in the workshop. I believe that Dr. Smith is going to talk about this. This is just a figure that speaks to what I mentioned about hybrid designs. And I said that hybrid designs are types of research that includes both an attention towards effectiveness and also towards implementation. And because people often get confused with the actual research design, and when we talk about hybrid designs, more recently, Jeff Curran, who is the leader in this area and the author of the first publication about hybrid designs back in 2012, is now referring to these as approaches. These are they're types of approaches that we use. And so we'll be talking about them as the hybrid approach. And so a hybrid approach varies. There can be type 1, which really focuses more on effectiveness, but also still is interested in looking at implementation and asking questions about implementation. A hybrid type 2 is when there's attention really equally to both of those. When you're testing a clinical or prevention intervention, but you're also studying an implementation strategy or more than one implementation strategy. And a hybrid type 3 is where the focus is more on the implementation strategy and testing it, but you're also maybe looking at some effectiveness and effectiveness outcomes. So you'll hear more about this, but I wanted to just give you a little bit of background because we're going to be using these terms. This is from an article that was also by Jeffrey Curran in 2020 called Implementation Science Made Too Simple. And I like it, and I know that people in the field are using this as a way to talk about and to clarify what it is that we're talking about when we're talking about implementation science or a particular implementation study. And so I'll go through it and you can choose to use it or not. The intervention, he talks about the intervention or the practice or the innovation as the thing. This is the thing that we want to get used. And the effectiveness research looks at whether that thing works. Does this innovation work? Dissemination and implementation research looks at how to best help people and places do this thing. And implementation strategies is the stuff we do to help people and places do this thing. And then implementation outcomes measure how much or how well have we done this thing. And so sometimes in implementation science, when we're trying to clarify what is the intervention or innovation and what is the implementation strategy, we may use terms like, what is the thing that we're actually trying to implement? In the field of implementation science, whereas I think when I started, we might say that it was in its infancy, although it is still young and it's still growing, it's probably more in its adolescent phase now, still young, still a lot more to learn, ways to grow and mature. But there are now many resources for implementation science, and these are just some of these. There's a journal And here I have implementation science, but there's other journals as well. There's textbooks, and over here to the left is probably the go-to textbook on implementation science, dissemination and implementation research in health, authored led by Ross Brownson and his colleagues. This is a new book that just came out, Practical Implementation Science, that aims to bring the field and the methodologies in the field to the real world. And I have a chapter in this text which is focused on identifying barriers and facilitators of implementation. Me and my colleagues, Dr. Bala Subramanian, who you will meet, and Dr. Laura Damschroeder, who is the creator of the CIFR framework, and many other well-known colleagues that have attempted to use and bring the science to implementation into practical terms. There's also other textbooks that are focused on particular areas. This one here, Advancing the Science of Implementation Across the Cancer Continuum, is focused on cancer. This text is focused on mental health. And we also have great conferences that have been over the last few years offered virtually. And I think from now on, even when they go back to in-person, we'll still include a virtual component. And those include the annual conference on dissemination and implementation research, which is typically in December, and the Society for Implementation Research Collaboration, or SIRC conference, which is every 2 years and will be this year in October. So many opportunities to learn more about implementation science. And at the end of this presentation, I'll be talking about some training, other training opportunities that you'll be able to explore more about. So there are different types of evidence-based interventions that can be implemented and disseminated. And these include things like clinical practice guidelines, clinical innovations, health promotion programs, policies, and then strategies or general recommendations, general approaches, like those that are in various catalogs, and such as the U.S. Preventive Services Task Force, which provides recommendations for types of programs that can be used, or types of approaches that can be used. There are many types of dissemination and implementation research questions, and we went over this in its own presentation in part 1 of the training. There are questions, research questions in dissemination and implementation that are about the factors influencing adoption, implementation, and sustainability of evidence-based programs, policies, and practices, or other healthcare innovations. And there's also questions and research that's testing models and frameworks, relationships between constructs and predictors of implementation outcomes. There are also measurement studies that are seeking to better develop and test measures of various implementation constructs. A lot of the early work that's been done in implementation science has focused on this first bullet, is trying to understand those barriers and facilitators to implementation. But perhaps the most important work that's done in implementation science have to do with questions related to the development and evaluation of strategies or groups of strategies to increase adoption, implementation, and sustainment. Many research projects in implementation science actually include both of these 2 bullets. So in order to develop strategies and to test them, we have to understand what factors are influencing implementation. Another area that's related to these is the testing models and frameworks. So we know that there are many models and frameworks. In part 1 of this training, we introduced you to several of these. I'll be talking very briefly about a couple of them now, but there's a lot of work that needs to be done with many of these models and frameworks. And so some studies of implementation science are seeking to understand the relations between the constructs in these frameworks. There are also questions about scale up and questions related to sustainability. So these aren't all of the research questions that are types of research questions in implementation science, but these are many of them. This is a diagram that helps you understand perhaps where you might be. It's been described as a subway line of translational research, and describes where one might be as they go along the research pipeline. So you have an intervention or practice of interest, and you might ask yourself, has this intervention or practice or innovation, has it been shown to work? Is there efficacy? And you can answer yes or no. If you answer no, then there probably needs to be efficacy research. And you may, in that efficacy research, also be starting to design, if this works, how might it be implemented? And certainly, as I mentioned before, even in the efficacy study, it has to be implemented. It may be implemented by the researchers, but it's still being implemented in some way in order for it to be tested. So even here, even in early efficacy research, you can still be learning a bit about implementation and designing the implementation strategies, or at least a precursor of the strategies. Sometimes we talk about piloting implementation strategies at this stage in research. If the intervention has been shown to have efficacy, and you answer yes to this question, then the next question is, has the intervention or practice of interest shown effectiveness? So it may have shown efficacy in a very tightly controlled environment, but has it shown effectiveness in a less controlled environment, in something more like a practice environment? And the answer could be no, and then you might want to do effectiveness research. The answer could be, well, no, but maybe partially. And then you may want to do a hybrid effectiveness implementation trial where you're still gathering data on effectiveness, you're still building the research, the evidence base of the effectiveness of that intervention. Or you might say, yes, actually, it does have strong evidence of effectiveness, in which case you may want to do an implementation study where you're testing the implementation strategies. But even along this pathway, there are still other types of studies that you may want to do. Often these types of studies are done within the context of one study, but they include mixed method studies to understand context, studies to design the implementation strategies, and then finally the development and testing of those implementation strategies. This key here has the color coding for where we're usually talking about efficacy, where we're usually talking about effectiveness, and where we're talking about implementation research. I'm going to say just a little bit about theories and frameworks, particularly for those who weren't available, but there are many resources for learning more about theories and framework that are available, and some of the websites that I'm going to mention at the end of this presentation that I encourage you to look at. But I will just say a few things about them. First is there is no comprehensive model that seems appropriate for use when we're studying or focusing on implementation in any particular program. In fact, there are many frameworks and models. Not all of them are well operationalized, But it's important that we realize that these models and frameworks are not static, that many of them are still being developed, but they still, despite that, can be very useful in our work. So what can they do? Why are they useful? Why would we want to consider thinking about a model or a framework in implementation science? One is that they provide a systematic structure for the development and management and evaluation of interventions and dissemination and implementation efforts. They can inform the selection and the development of implementation strategies. They can enhance the interpretability of our findings. So we may have an implementation strategy, for example, that was addressing certain factors that influence implementation, but maybe not all. And if we have a framework that is telling us that there are these many different factors, it can help explain why an implementation strategy did not work completely. It can help us provide guidance about what's important to measure. So we may not be intervening to change all of those factors that could influence implementation, but we still might want to measure some of the important ones to see how they influence outcomes. They also provide an explanation when interventions or implementation strategies don't work, and they provide an opportunity to advance our understanding in the field of dissemination and implementation science. This slide shows, is adapted from an article from Per Nielsen, where the team looked across all of the many frameworks and models in implementation science and tried to sort them out in various buckets. And they organized them in these three broad categories. On the left, we have those models and frameworks that really describe the process, right? And we call those process models. They describe the process of translating research into practice. And that model that I showed earlier, that showed from efficacy studies all the way to implementation studies, is an example of what a process model might look like. Then we have, over to the right, models and frameworks that are really useful for evaluating implementation. The Proctor model comes to mind, REAIM framework comes to mind, and these are what we call evaluation models or frameworks. And then perhaps those that are most useful for informing the development of implementation strategies and also for understanding those factors that could influence implementation are what are these frameworks that are for understanding and explaining. And these are further broken down into determinants frameworks, classic theories, and implementation theories. And that's as far as I'll go now, but I encourage you to look at this article and also look back at the previous lecture that we gave on implementation models and frameworks, as well as some of those resources. But I will mention a few of them because I think that they're highly used, really recognized, and important to just have at least a brief understanding, some understanding of them. One of them is diffusion of innovation theory, which was developed by Everett Rogers. I was fortunate enough to meet Everett Rogers probably about 20 years ago in an early conference, one of the earliest conferences on dissemination and implementation research in the United States. And Everett Rogers was a developer of the diffusion of innovation theory. And this theory examines how new ideas, products, and behaviors become norms. And it deals with behavior change related to implementation at all levels, at the individual level, at the interpersonal, community, and organizational level, and integrates related theories to help explain diffusion. It helps understand how new ideas, products, and behaviors become norms. And it describes that success in diffusion is determined by things like the nature of the innovation, the communication channels, the time that's available, and the social systems through which these innovations are being diffused. These are our diffusion curves, and on the left we have sort of the normal diffusion curve, and you'll see that there are typically early adopters, those individuals or organizations that right away, when something becomes available, they want to use it, right? These are the early adopters. And then over time, others become adopters and start using an innovation. And then there are these late adopters that it takes quite a bit of time to then finally adopt and use innovations. And there are many examples of this. You may think about yourself and see if you are an early adopter of some technology or some new innovation, or whether you liked things as they were and it took quite a bit of time to become an adopter of an innovation. The same holds true not just for individuals, but also for organizations and even systems. In implementation science, what we're trying to do is to shift this curve so that typically late adopters become early adopters, and there's an accelerated adoption, implementation, and sustainment of new innovations. Another framework that's often used is the REAIM framework. REAIM stands for reach, efficacy or effectiveness, adoption, implementation, and maintenance. And the REAIM framework helps us understand how do we think about the evaluation of our efforts, how we can think about going beyond just effectiveness or efficacy of the innovation, but also the reach. To what extent has this innovation reached the population? To what extent has it been adopted and used in settings or implemented with consistency and fidelity? And to what extent is it maintained over time? So the REAIM framework, and there's actually a website specifically on the REAIM framework, is one that's widely used. Another framework that's widely used is the Consolidated Framework for Implementation Research, which is considered an overarching typology that was developed by Laura Damschroeder and her colleagues, and I would say is one of the most widely used, along with the other two that I just mentioned. It was created in 2009 to really coalesce multiple implementation theories into one framework that would contain these large domains and many frameworks within those domains. So I won't say much more about it, except that this the Consolidated Framework for Implementation Research considers intervention characteristics, and here you can see there's an intervention. This represents sort of an organization or a system in which this intervention is being implemented. And you can imagine this intervention sort of moving through this system. And when it comes out, or when it's actually used, it actually is usually adapted. There are forces outside of the system that, or the organization, that are influencing its use, and this is known as the outer setting. There are things that go on within the system, and these are considered this is considered the inner setting. There's a process through which it is implemented, and that's another domain down here. And then there are individuals involved, and individuals have capacities, they have knowledge, they have motivation. These are all things that influence whether or not something is implemented. So this framework is a determinants framework. It can be useful in trying to understand what are all of those factors that could potentially influence implementation. How do I measure those, and how do I account for those? So I'm going to go a little bit more quickly, because I see that we're getting close to my time here, and I want to make sure that we give Dr. Gang his full amount of time. So I'm going to go a little bit quickly. You all will have a link to the presentation that we gave in the first part, which covers a lot of this. So implementation strategies are methods or techniques that are used to enhance adoption, implementation, and sustainability. I'd like this quote by Carolyn Clancy that says, it's how to make the right thing to do the easy thing to do. We know that there's a lot of work that's been done in understanding the types of implementation strategies, and this is just a few articles that have been instrumental in helping us understand the types of implementation strategies, and they have resulted in a compilation. There are many compilations of implementation strategies. This one is called ERIC, which stands for Expert Recommendations for Implementing Change. And while there are implementation compilations of implementation strategies like ERIC, there are some challenges in selecting implementation strategies. And some of these include that while some of compilations like ERIC exist, they may be less relevant for certain settings. The strategies included in these compilations are really broad, and they may represent qualitatively different things. Some of them are delivery channels, some of them are assessments, some of them are processes. There's actually quite a limitations in the literature, not only describing strategies, but also understanding whether or not they work. And there's an underutilization of conceptual models and theories in how do we choose these implementation strategies. So there's various ways of designing and tailoring implementation strategies. And in this article a few years ago, they highlighted intervention mapping, which is something that you'll hear more about tomorrow. Intervention mapping is used to, it's a process for planning health promotion programs, and it has been used to inform dissemination implementation in a number of ways. The first way is in designing programs in ways that will enhance its potential for being adopted, implemented, and sustained. And this is actually the traditional way in which intervention mapping is used. It's to plan multi-level interventions. It can also be used to design dissemination interventions or strategies to influence adoption, implementation, and continuation. And we'll be talking about this tomorrow. And then it can also be used to adapt existing evidence-based interventions. So this one in red that I just showed, we call that implementation mapping. And a few years ago, we published this article on implementation mapping, which was an attempt to describe how intervention mapping could be used to plan implementation strategies. And it's been widely adopted. And in fact, there's going to be a special topics issue in Frontiers in Public Health that's highlighting its use. De-implementation is another important topic. How do we stop using something that's been used and is no longer valuable? And I'm just going to close by telling you that there are many opportunities and needs in implementation research and implementation science. These are some of these. The next few slides just go through various resources that are available. So I encourage you to look at these. There's training opportunities that are available, many of them online. There are ones that have global health focus, including training programs that have been sponsored and supported by WHO, like these. We have developed some training opportunities as well at UT Health. We're currently working on a certificate program in implementation science. We have an annual implementation science workshop that we conducted in 2020, and here's the link to that. And we'll be doing another one this fall. And there are some other online resources that you can explore. And so just to summarize, I think implementation science can help bridge the gap between research and practice. And there are many areas that we can do this. And so we're really pleased that you're interested in it. We need everyone to be working on ways that we can advance what we've learned in research to make an impact in health. So thank you, and turning it back over to you, Sidra, to transition to our next speaker.